Okay.
So, good afternoon, everybody. Welcome. Can we just do a roll call, please? Ask Leslie to see who's attending this Health and Wellbeing Overview and Scrutiny Committee meeting.
Okay, we're going with the members first. If you could say present when I say your name. Councillor Armstrong.
Present.
Bowman.
Present.
Desford.
Present.
Dungworth.
Present.
Hutchinson.
Present.
Nisbet.
Present.
Patterson.
Present.
Rickaby.
Present.
Simpson.
Present.
And Watson.
Present. Thank you very much. Do we have any apologies for absence?
No.
Okay. All right, then we'll go straight into the minutes of the last meeting, which was held on the 2nd of June. You should all have got those and had a chance to read them. A lot of it about COVID on that meeting. No doubt there will be an opportunity to have an update on those issues that we raised at that time in the presentations that are following. So we will, if no one has any objection, I will sign those minutes as being correct. I'm not seeing anybody or hearing anybody objecting to that. So
Councillor Jones wishes to come in.
I've got my hand up, but I don't think you can see me. I've only just spotted that I don't appear to have been present according to the minutes, and I clearly was, because it later mentions my name when I spoke, so it doesn't say. So I'm sorry, I should have spotted it earlier, but I was present at the meeting.
okay, Chris, you make a note of that. Thank you very much. Right, disclosure of members' interests. Now, this is the opportunity where, as usual, where you have the ability to disclose any interest that you haven't declared already. It has been touched on that one or two people may have been the beneficiary of grants from the council. So if you feel that you need to declare any additional interest for this meeting, then probably now is the time to do it. But I personally, I've involved in several different charities and things which have had grants, but I don't think that I have a personal prejudice and interest on them, and I've already declared them on my list, so I'm not going to declare anything at all. So if anybody else has anything they'd like to say, now is the time. Trevor, I can see you.
Yeah, I'd just like to say, Jeff, that I'm the treasurer of one club that received a grant. So I think, but is there no? Hello, are you still there?
Yes.
All right, I've lost you off the screen, but I have no prejudice at all.
Okay. Susan?
Yeah, I'm a member of a community association that received a grant, but I obviously received no personal interest from it.
Okay. Now, I can see several people, but one or two I can't. If there's anything you want to declare, please unmute yourself and say it now. Okay, fine. I'll take that as being okay then. So we'll move on to agenda item number 4. Just before we do, there's going to be a slight change in the agenda, that we're going to put item 7 before 6. So in other words, Health Watch will be the last thing on the agenda today. And to introduce the next report on item 4, we're going to have Daljit, who's going to take through most of it, helped by Liz and also by Val Veronica at the end. Sorry, Veronica at the end. So I'll pass it over to you, Daljit, and the three of you can sort of work out exactly how you're going to present the two reports.
Thank you, Chairman, and hello, members. Thank you. It's lovely to see members of the committee and other organisations today. So we bring forward 2 reports to you today, which actually detail, the first report details our COVID response from an operational perspective, and the second report gives you the overview from a recovery phase in terms of both economic and social recovery across the county. As you can imagine, it has been quite a difficult time over the last 14 to 16 weeks, and there's no real end in sight as yet, even though the lockdown is easing somewhat. But in terms of protection of our communities right across the county, and also our more vulnerable communities, and also the protection of our staff, it's been critical to ensure we have the right arrangements in place. So the reason for bringing the reports today is that twofold really. Firstly, to ensure that as members of the council, you are fully up to date and you have the opportunity to ask any questions or any detail. One of the things I will say is that the reports are going to all 4 scrutinies, but we have left this a little bit open. So I know this is the health and wellbeing scrutiny, but obviously because some of the other arrangements aren't in place currently for members, there's no issue if members want to raise anything either now in terms of the wider report or late, after the meeting with officers of the executive team or myself. We do try to keep you up to date through the regular chief executive briefing. Obviously you receive the staff briefing too, which means you're fully up to date from an operational perspective, and we hope you find that useful. I'd just like to start off though just by paying a small tribute to the staff teams across the council who in all aspects have, whether working from home, being shielded and continued working, or being out there with our very essential services, who have really gone the extra mile. So I'll just run through a little bit of, in terms of the first report, I would just like to cover, so you're very clear about the operational arrangements. We enacted very quickly, as you're well aware, the ECAP plan, which is our emergency plan. We then supported that through the community business continuity plans that were already in place and up and running. And as you'll be aware, the council's emergency committee has met on 2 occasions with member oversight, with additional invites through to all group leaders to those meetings. From a day-to-day perspective, the council's gold strategic command has been in place. That is managed weekly. We have a regular COVID executive gold team that's chaired by myself on a weekly basis. And then we have the operational arrangements of the business interruption management team, which Stephen Holmes chairs for us on a weekly basis too. So we have ensured that our local council arrangements are very much up and running and business continuity measures in place. In terms of linking in to the region, we are proactive members of the 6th Authority Local Resilience Forum, which is a much wider multidisciplinary team effort. Members will be aware there's NHS England representation and fire services, Northumbria Police, ambulance service, so a wide range of services linked up there to find a cohesive set of arrangements going forward. The types of things the LRF has been responsible for have been looking at unfortunate things like body storage, for example, and excess deaths, but also testing and arrangements. What I would say is, this has been a very unexpected. The scale of this crisis has been unexpected. So there have been some teething issues in terms of the Local Resilience Forum. But what I would say to you, as you would expect me to as the Chief Exec, I have been very clear about the Northumberland position in relation to some of those issues. So in terms of my report today, I would just like to say to you that there's 4 priority areas that we've looked at really, and those are the rapidly changing environment that we found ourselves in, and I'll cover a little bit about our business hub and our Northumberland Communities Together arrangements. Second area really was for us to ensure, as a statutory set of services on most occasions, that we've delivered our essential services for residents across Northumberland, and also being mindful of our staff in that arrangement. Thirdly, obviously critically around the staff health and well-being, and that's been vital. We've had to put shielding arrangements in, testing arrangements, but you know, a lot of our staff are now very effectively working from home where they can, and we're very clear that the government advice through public health remains, wherever possible, 2 meters social distancing and working from home. I couldn't resist just getting that in for everybody there. So I just think it's really important, even more so now. And Liz will probably cover a bit of that shortly in terms of keeping our community safe and taking a very sensible approach to the reopening of services. So I'll just move on a little bit to the community hubs. The community hub. As you'll be aware, we were required to stand up at very short notice the community hub. It was really around protecting our most vulnerable in society for a variety of reasons, whether those were economic, social or health reasons. We have over 18,000 residents who are shielded across the county, and I was quite amazed to learn that we've had contact or put arrangements in place for over 13,000 of those, so quite a massive effort to stand up with our key partners in this very short period of time. On an outward basis, we've had 8,000 connections, whether that's by visits and calls, through to help monitor need and welfare requirements. And over 1,000 of our residents have registered with us as volunteers over this period. So, you know, this has been a council coordinated but a very community-based response through the hub. A lot of very local charities, volunteers, organisations have come together in different ways and different localities and provided actually numerous types of response, but very useful, sensible, localised responses. And our role in that has been to coordinate that through holding the data, you know, making sure people, whether it's medication they needed to receive, whether it was food parcels and the ongoing arrangements, or actually some of the loneliness and isolation issues about contact with people. So it's been a really good effort all round. If I just move on a little bit to adult social care, as you can imagine, as a statutory service, this has been a critical area for us, and we've needed to ensure that we meet our statutory requirements. Everybody will know about the information that's been out there around, particularly care homes, which is one small part of that care service we provide. But we very deliberately took some early decisions, had discussions with the CCG and our health trust partners to ensure that we had a really effective response into care homes. From a very early date, Stephen Holmes put up a massive effort around the PPE provision. We've worked with our procurement team on that, and we've ensured that all of our care services have had a regular weekly free supply of PPE. And they're very appreciative of that, and we've had a really good, effective working partnership on that. Alongside that, obviously, they have had other levels of support around financing, particular significant level of funding's gone in on financing, and we continue to work with them around the care and support training for their staff. So if I just move on a little bit there, in terms of our business hub, as you can imagine, with the council's responsibilities, the delivery of our business and economic functions have been critical in this time, particularly as there have been numerous issues during lockdown, you know, whether it's furlough, business support, accessing of grants. We've dealt with over 99.7% of the 9,468 applications for funding, with many millions of pounds given out in terms of the grants that we've awarded. So we're at about £86 million of grant with some additional funding for the discretionary grant of about 4.6 million. So if you think about our revenues and benefits team, who generally are quite happy to bill people and seek funding from them, they've had to put in with our IT team within a set of arrangements which has then sought for them to pay out grants of 10 and 25,000 to thousands of businesses across Northumberland, and the teams have done made a great effort to do that, and we've had a lot of positive feedback from right across the county about the funding that we've administered on the government's behalf. So in terms of just giving you a very quick run through of the service aspects, obviously what we've tried to do is that all essentials services have operated. Some of the services where it's been necessary to close down because obviously of lockdown arrangements, we have done that. But some of those we've needed to keep running. So a good example might be daycare for older people, where we were required to lock those arrangements down. We've ensured that people have daycare into their home or supported arrangements. So although services may appear to have been closed, all essential frontline staff have actually been out there working, unless obviously they're risk assessed as shielding. We've then, along, whether it's local services and maintaining the refuse collection, we opened our household waste recycling centres very early. We've then moved on with member discussions, and hopefully I do hope that all members feel wherever possible that we've consulted them before reopening services or looking at alternatives ways to provide. And I know we've tried as an executive team to maintain regular contact. We very early put in the arrangements to ensure that each member had a named senior officer for contact purposes. I've had some feedback about that. That's generally well received. And then, some of our corporate services have continued just in the background here at County Hall, whether that's communications or a great effort from the customer services team, who changed their model very quickly from taking calls to outreach calls too. So there has been a lot of work gone into these arrangements. In terms of the recovery report, I'll just make a few comments before I hand over to Liz to cover the public health information. In terms of our economic recovery, we have now a very clear operational group in play, which has done things like overseeing the operational opening of the town centres. So you will have been consulted as members on those issues. We've looked at the arrangements for our planning committees, and obviously we've had a couple of virtual planning committees now. I know there have been some queries around the local area councils, and who would have thought it, but members asking me to get them back up and running as quickly as possible. So we'll to do that virtually, and I look forward to seeing everybody on those. But, on a more serious note, it's been a really difficult time. I feel the staff team, and I, just pay a bit of tribute to the executive directors particularly, who have all been leading in their specific areas. Liz Morgan too, just basically cracking on with the work. We have our own bubble here. We've been trying to work hard to keep those services running. From a particular health and wellbeing perspective, obviously they are statutory services, some of our most vulnerable communities, and quite helpfully our frontline staff have delivered those essential services as and when required. So from a recovery perspective, we're homing in now, particularly on some of our business opportunities, with our tourism, trades, our caring trades, our small businesses, our rural development, our urban small and medium enterprise. There is a lot of work to do from a recovery perspective, and we are doing our best to seek as much central funding to support our own funding to ensure that the county has a good and prosperous future. We're really clear about things like, as an executive team, supporting particularly people, for example, who may be unemployed or more vulnerable and require that bit of additional help. People who probably previously, would have spent some time in libraries, for example, or with community groups who maybe aren't operating. Some of the people who maybe link into food banks, etc., from a care and wellbeing perspective. So it's important to us that there's one-to-one support available, group support available through our great community and voluntary sector arrangements, and the whole economic and social delivery plan is based around our communities and our people. So I'll just hand over, if that's okay, to Liz now, because I'll ask her, just with it being the care and wellbeing scrutiny, to give a bit of an update from a public health perspective. Thank you.
I think that's fine, and I think if we can perhaps leave any questions that we may have until Liz has made her talk, because she may address some of those questions in her presentation. So Liz, can you take over now, please?
Yes, thank you very much, Chair. So nationally, things are, generally going in the right direction. So the number of cases have been reducing over time. Probably fair to say that they're now plateauing off. Admissions to hospitals are continued to reducing. The number of people on respiratory support in hospitals are continuing to reduce, and as are deaths. More locally, in terms of sort of numbers, we've had 1,577 people test positive through the various routes. Over the last 3 weeks, the rate of positive tests has varied from 2.81 per 100,000 to 3.43 per 100,000. But in terms of actual numbers, that's really only the difference between 9 and 11 people per week. We've had 275 people who have died with a mention of COVID-19 on their death registration. Those are occurrences up to the 3rd of July. And I'm very pleased to say that over the last 3 weeks, we've literally had 1 or 2 deaths per week. And it's great that those deaths are really beginning to fall, but obviously it's a tragedy for every one of the families involved. We have started to get postcode level data. We're really pushing to get that daily rather than weekly. There's additional information that we want collected. We're really pushing to get the quality of that data improved as well. We're also getting increasingly sophisticated reports from Public Health England, and taking all of that information together, that gives us a reasonable picture about what's going on across the county as a whole. But that data does require some quite careful interpretation. The testing has changed over the last couple of weeks, particularly for care homes. So last week, care homes were offered regular testing. So they will be invited to test all residents every month and all staff every week. And that will be done through the online testing process. For all outbreak situations, all of those test results initially will be done through Public Health England laboratories, which for us is at Newcastle. But there is a move to move that testing more locally, so that that's done through Northumbria Trust. And the advantage of having the test done locally is that the turnaround time for the results is much quicker. We've also now got our local COVID-19 outbreak prevention and control plan in place. The Health and Wellbeing Board is responsible for the delivery of that. That plan really outlines how we'll use our local knowledge, experience and expertise to prevent outbreaks and really to manage this infection over time as part of the wider test and trace programme. So at the moment, all of the evidence that we've got on COVID-19 as it relates to Northumberland is that things are pretty stable. But if you've been watching the news and read anything about Leicester, Bradford, Bedford, and a whole range of other towns and cities, you'll realise that actually things can change really quickly. And that's why Public Health England and ourselves are, looking at this data on a daily basis. That's also the reason why it's really important that we continue to follow all the rules. So that's the rules about social distancing, and the guidance is still that we maintain that 2 metre distance where we can, that we continue to be absolutely scrupulous around hand washing, and finally that we are alert to symptoms. We self-isolate if we think we've got symptoms, get ourselves tested, and if we're positive, engage with the NHS test and trace. And that's the way that we will continue to manage this infection over the next few months. In terms of how long it's, we're going to be in this situation, I really can't see anything changing this year. I can't see anything changing until we have either a vaccine or a cure. I think it's unlikely that this infection will go away on its own. So I think, we are definitely in it for the long haul. That's probably about all I want to update you on, but obviously very happy to take any questions if you have any.
Thank you very much. Do we want to take questions before Veronica rounds up, or Veronica, do you want to round up and then we'll take questions all together? Are you there, Veronica? Are you there, Veronica? I can't hear you. Okay. It looks as though we've lost Veronica, so we'll go straight into questions then. And I can see Susan's got her hand up, so perhaps we can start with you, Susan.
Yeah, thank you, Chair. Sorry, I've disappeared off the grid again, having thought I sorted that out last week, so it's a bit more difficult. Thank you for those reports, and I think you summed up in quite a lot of pages actually, but you've summed up very succinctly not just what we've done but also what we need to do as well. And I think obviously we need to start with thanking you and your team and your staff, those who work right the way across the authority. I think what has been amazing is that we have continued to do as much business as normal if we look at this report. And with the issue over actually being in physical contact with people, we've continued to support people, we've continued to deliver. And I think also what isn't necessarily recognised is the different levels of support within all of those teams for people in the teams. So I am aware of team managers keeping in touch with people, sending out sweets, having, regular team meetings. And that's what enables people to carry on delivering for other people, actually. So thank you for that. I think communication has been excellent for the public and for staff as well, and for members. And I think you have ensured that we've been kept in touch with events as they happen or actually before they happen. I think social media has been really good in terms of succinct, very clear messages coming from this council and its partners about what people need to do and where people can go for support. And as you mentioned in the report, the IT service have suddenly gone from being the ones that nobody saw and just quietly got on in the background and nagged us occasionally to actually being front and centre. And I think what they've done and how they've stepped up in such a short time without being able to sit next to people and explain things has been astonishing. So I think what we need to make sure we do out of this is not learn a lot of these lessons about how we can work flexibly, how we can work remotely, how we can engage a wider group of people, sometimes by doing that remotely and not hung up on let's just get back to as it was before, because I think that we've learned a lot of skills and a lot of good things out of this process. I think the other people who have been helpful both in the local authority and for whom we need to be working with when we're looking at recovery is the trade unions. And I think it's being recognised that those places that have strong trade unions, that have good relationships between the trade unions and the management, actually being able to bring in changes and support their workforce more effectively to do that. And if we look at some of the issues around some of those workplaces that present the greatest challenge for us going forward, one of the key things often that binds them together is they're not unionised and they don't have that body to go through. So in terms of, I just have a few questions from the report, and I went through before and noted them down. One of them is around how we've built up those systems that are almost despite what's gone on. So I'm thinking particularly around PPE, where we found our own way of sourcing materials and making sure they got to the right people. I'm wondering if that is going to continue, because, you know, it might not be COVID next time, it might be something else, but, you know, now we've got those links and networks, have we got a way of keeping that going? When a home visit's going to start again, and home assessments, some of them might be doing Daljeet, I'm not sure, but the feeling I got from the report was they were very much being done remotely, and it's when that direct contact, obviously safely, is going to happen, because with both children and adults, sometimes you actually need to be there to see what people will tell you over the telephone. Is not necessarily the full story, so you actually need to see them in their environment. You've talked about the increased number of children in care because they've not been able to move on. Have we had any children who've been stuck on remand in our accommodation? What has been the effect? And I've not seen anywhere sort of feedback about the young offenders that we provide services for. And I suppose similarly around education and health assessments, I know that we've been given longer to do it, but are we still keeping on top of them? How's that working? Because there will be a lot of parents who will be hoping for them to be in place for September. And I suppose my final point, because I would prefer to do the recovery bit separately. I almost feel like the recovery report I had separate things for, but on that first one, is the issue around council meetings. And I think, again, we've done really well to get meetings like this up and running once it was appropriate to start doing that. I am still concerned that we're talking about full council when I'm not aware of any other councils in the region who've done an annual council meeting this year. They have all carried them over till next year. And, you know, there was good reasons why the legislation allowed us to do that. So I think that's my questions around your first report.
Okay, thank you. I hope, I think there were 5 questions there. Veronica's back. I don't know, Veronica, whether you want to actually speak now or and then go into those questions. Can I also say that Susan, I think, expressed a lot of things that all of us would be wanting to say, and I would hope that you don't repeat those again, because that was the longest question I've ever experienced in my time as a chairman, including 5 different questions. So let's try and move on. They're all important questions, by the way. So Veronica, do you want to speak now, or do you want to?
Yes, Chairman, I've taken the camera off as the connection gremlins hit just as I was about to speak before. So I think, to be frank, it's probably better if I do it now. Okay. Simply because at least I've got a signal of some sorts at the moment, so I might strike while the iron's hot, if that's all right.
Okay, yeah? Fine. Go ahead.
Yeah. So, well, thank you, Chair, for letting me speak. In terms of the response report, I think this effectively summarises what's been a comprehensive and robust response right across the council to what has been a truly unprecedented set of circumstances. And has been highlighted, COVID is still with us. It remains an evolving situation, as we've seen in Leicester and other places recently. So I want to thank Daljeet, Kath, Liz and the whole team for their fantastic efforts, but we're never complacent and much remains to be done before we're through this. You've heard an outline of the arrangements that have been put in place. Just a minute, I lost my note there. Put in place to respond to the COVID crisis since before March, and our priorities were to respond to the rapidly changing situation, which meant establishing new structures and delivery, for example, the Business Hub and the Northumberland communities together. To continue to deliver essential services for our residents in much changed circumstances for staff and residents, and to look after the safety and well-being of our staff, and to start thinking about the recovery at an early stage. Alongside those officers' arrangements, as you would expect, Cabinet and indeed all the elected members have been kept in touch, close touch, with what has been happening throughout the COVID crisis, and able to direct and shape our response and make decisions quickly and effectively. For my portfolio, this is focused on particularly on quickly establishing the vital support mechanisms for supporting the most vulnerable people in our communities up and down the country, of course in close partnership with our partners in health, community and the voluntary sector and other agencies. And I have to say our officers and partners have done a fantastic job in being able to establish support for residents, navigating all the complexities in terms of guidance, accessing supplies of PPE and even basic foodstuffs for residents in need, and all in what was a matter of weeks and sometimes, if not days in some cases. I'm particularly pleased with our response in terms of establishing the community hub and how our adult social care has adapted fantastically to a fast changing situation. Through our adult social care service and the new Communities Together hub, our new operating model has supported hospital discharge, worked in different ways to older and vulnerable people who no longer had to visit day centres, and provided day-to-day basic help to people who have needed it. We have got vital supplies to PPE to providers and given them that certainty of funding and managed to quickly bring in additional social care staff. The Northumberland Communities Together, which was set up on the 18th of March to provide a hub for individuals and communities to provide support. The hub has delivered and facilitated activity with a lot of the action taken by our communities with support from local businesses, making deliveries, donating food, products and money. One of the early and most significant actions for the council is making sure that people who were shielding and therefore unable to leave their homes were firstly identified and secondly provided with basic food and essentials. The report outlines the numbers, but there are over 18,000 shielded residents in our county and over 13,000 of which have received some support or contact from the hub. The hub made over 8,000 calls out to vulnerable residents to check on their welfare and their needs, and over 1,000 residents registered as volunteers to help deliver that support to their communities. In terms of the recovery report, as you'd expect, there is a lot of emphasis on economic recovery because it is vital that we get the economy going again, helping people to reopen their businesses and people to get back into work. And for me, that is vital to the health and wellbeing agenda, because we know that the detriment to health and wellbeing that people experience by being out of work or seeing their businesses go under. So economic recovery has had a huge part to play in health and wellbeing in the county. And I would include in that the recovery of the care sector, where we are monitoring the situation closely to understand the longer term impacts of COVID on that sector and how we as a council may have to adapt. And I'd also like to point out that as we've worked with businesses to reopen, particularly getting our town centres up and running again, that the health and safety of our residents and workers has been paramount. And the advice and support from our Director of Public Health has been clear and effective in that regard, as it has been, to be honest, through the whole of the COVID crisis. The recovery report also outlines our plans in terms of continuing to support communities to recover through the community hub and in supporting children and young people to recover. Although that is, of course, much more Councillor Davies' portfolio, supporting our children and young people to recover has strong links to health and wellbeing, particularly the mental health of our young people as they cope with the impacts and recovery. So that's just an overview of our plans. That's much more in terms of detail, but I would echo the point about this being an evolving situation and the need to adapt and flex our recovery plans to meet the changing circumstances. And we expect further reports into Cabinet on our recovery plans in the coming months. Thank you, Chair.
Thank you very much, Veronica. So perhaps we should now go to you, Daljeet. There was 5 questions from Susan, but I don't know whether you want to answer them yourself or pass them to Liz. And I reckon the questions were about PPE, about home visits, about children stuck in care in remand centres, the resumption of council meetings, and education. So there's 5 good questions for you. I'll pass over to you now.
Thank you, Chairman. So I'll take the question on PPE and council meetings, and I'll ask Kath McAvoy-Carr to pick up the children's issues around contact children's potential remanded children or young people and EHCPs. So in relation to PPE, as Councillor Dungworth said, that was a very quick issue that came to light. Now, obviously, through previous business continuity arrangements, PPE had been identified, but, you know, being frank, nobody in any service area ever thought that we would need it to the level that we did. So, you know, I have to give credit where credit's due. Stephen Holmes, from a standing start, within a week, became our PPE czar, along with Teresa Palmer, our shared head of procurement. And between the pair of them, along with them, I very deliberately took a delegated decision, because it is one of the learning points from the local resilience forum, the national approach. You know, I wouldn't criticise anybody about any of this, because it was a day-to-day challenge. What the approach was, there would be national arrangements, and quite rightly, some aspects of service had to be prioritised given the supply. So very quickly, I suggested to Stephen and Teresa that we arrange alongside that, and if that all worked out well, it would be great. But actually, as a council, our own supply, and in the beginning I needed them to get me to a position where we would have a 6-week supply for all of our care services, and within a week they stood that up. They had sourced very effectively PPE from wherever they could, and we were in a really good position almost immediately. The worst case scenario we had, it was a period where we had a week plus 4 days supply, but it still felt comfortable, because 10 days in this scenario was a lifetime. So we are now, they then within 2 weeks had a 6-week supply. Within 3 weeks we had a guaranteed 10-week supply. Then within the next 5 weeks we had a further 10 weeks. So we were working on a 5-month supply, so we, you know, have had that in place. We've in the last couple of weeks put arrangements in place so that we have a supply for the next year. And that means that we know for our services, all of, whether it's, you know, the independent care homes, domiciliary care providers, our own in-house services, and anyone else, for example, funeral directors who we're responsible for, we have an effective supply in place to get us right through the winter, right through to early next year. Obviously that comes through a form of delegated decision. As soon as that sign off, as the leaders of groups know, I always send my delegated decisions through for people to see. So you'll be kept in touch if it's out with of my delegated spends. But a very effective PPE line in place. We've also, as I've said in the elected members briefing, got some very snazzy Northumberland buffs, which have now been delivered. They'll be coming through to you. We'll get them sent out to you, and it works well, particularly with the announcements this week about face coverings in shops, etc. We've got about 20,000 of those in stock now, so obviously you just need to let us know your requirements and we get them out to you. And it's an ongoing issue, but we are, from a local authority perspective, well covered. In terms of the meeting arrangements, this has been an ongoing discussion, I'm aware, with the group leaders. we've been very clear that following the guidance that Liz very carefully explains to us regularly, quite rightly, have been very clear to follow the guidance about virtual meetings. In terms of an annual council, I think we were in the position where we said we wouldn't be holding an annual council. I haven't notified, and I know Democratic Services haven't notified an annual council. I was going to say worryingly, it's not worryingly, as you know, I'm delegated to act on behalf of full council through a crisis and emergency. That's covered in the Constitution, and obviously the Cabinet is regularly meeting to take Cabinet decisions. Now, obviously, I would never take a delegated decision on behalf of council without consultation with the group leaders if it was something very significant. I think we've got a period of now 4 to 6 weeks maybe, just to be watchful, mindful, and think about how our meetings will look in the future. For a good while, I think we will need to continue virtually. I can't imagine we would want to have full council in September unless it was absolutely essential. But we'll, you know, I'll consult with Richard Dodd as the chairman and with other members and group leaders as we go. I'll just hand over to Kath to cover the children's issues.
Thank you. So I think there was an issue about visiting both adults and children, about how we do assessments, whether or not they be direct or virtual currently. And I think you'll be aware that there was some flexibilities provided by the government to allow us to be able to do much more of that work virtually rather than actually going out to visit face to face. I think it is probably fair to say that for a high proportion of the work that we're doing now, or for a proportion of the work that we're doing now, we're starting to see business as usual. So we are starting to do visits. With children, it's a little bit more straightforward because families are wanting and willing to have social workers in the home. Some of them are, some of them aren't, obviously. But for some of our more vulnerable adults, we are having to do a risk assessment in relation to individual circumstances, whether or not families want their relatives being visited or not, whether they're happy with the virtual means. But we are using risk assessments to ensure that we get the right information where we can. In relation to children, face-to-face family contact time, which has been suspended since the start of lockdown, is starting to be reintroduced for our looked after children on the basis of an individual risk assessment, so that we can determine what the risks may be. We've continued to do child protection inquiries face to face because it's very difficult to do those not face to face. So whilst we've welcomed those flexibilities because it allows us to keep into contact with our children in a more regular basis, if I'm honest, we have maintained face to face visits in order to ensure that we are assured that children are safe. Was there a question about children in care?
Yes, there was one about the people who are stuck in our.
I asked the question about young people who might be remanded, Kath.
Right. Okay. So we again, we don't have a particularly high number of children who are young people who are remanded, and I've just texted somebody to actually get the numbers of people that we've got currently on remand, because that changes on a day-to-day basis. But we have ensured that there've been appropriate safeguarding arrangements in place in order to be able to maintain the contact with those particularly young people. In terms of EHCPs, we have continued to undertake our EHCPs and to catch up on any of those that might not have been progressing as smoothly as we wanted them to. Our education psychologists have been very active in the work that they've been doing. The SEND team themselves have continued to do assessments. The flexibilities are running, I think, until the end of August. Forgive me if that's wrong. Just there's a number of changes that are coming about currently, but I think they're continuing until the end of August. But we are, wherever possible, continuing to deliver as business as usual, because what we don't want is to start start a new term with some significant challenges.
Thank you very much, Kath. What about you? Can I ask a couple of questions on schools as well, please? 2-tier, 3-tier seems to be something which hasn't really been sort of recognised by the government, and I wonder what your comments are on that. And the second one is, when we've been doing testing, what have we been doing about teachers? I mean, it would seem to me to be a sensible thing to, if someone has got a symptom, to test or to offer to schools and teachers testing that we haven't been. I think we haven't been offering so far.
Yeah.
Just want to comment on that as well.
So in relation to the 2-tier, 3-tier issue, I think very early on it became clear that there was not a particular priority in relation to understanding first schools, middle schools and high schools from the DFE. I think there was the recognition that was the situation, but for a higher proportion of the country, this was around the 2-tier system. The focus was actually on the educational transition point. So in terms of the key stages where testing would take place. So for children for key stage 2, the end of year 6 is a key testing point. So, and for a high proportion of those, they move on to another school, but for a lot of hours they don't. And again, the key stage 4 going into key stage 5 when they're going into a sixth form. So I think I wouldn't disagree that wasn't really prioritised, but there was a rationale provided. We did lobby on a regular basis to ensure that first schools and middle schools were not left out of the equation, and there was a response in relation to that once the opening up was tested with those initial small year groups, and the DFE did allow us some flexibilities in talking to our schools about offering places to other children who may not be part of those, the reception year 1, year 6 and year 10 and 12. In relation to the testing of teachers, I'm going to hand that to Liz because there's been some recent changes in light of the more wider opening of schools, and she's probably got more technical knowledge in relation to that.
Thank you. Yeah, so in terms of sort of testing of whole schools, we probably wouldn't really be embarking on that unless we had a complex outbreak in a school. At the moment, our sort of testing for sort of case finding is really restricted to care homes, because that's where a large proportion of the transmission is and where our high risk populations are. I think it's probably useful to point out that at the moment the sort of background community transmission rates of new infection are really low, and actually I looked at the ONS survey data just before I came into the meeting, and they're estimating that in the last 2-week period that they surveyed, that about 1 in 3,900 people are infected at any one time. So you'll appreciate that if we did testing in a school based on a single case or even 2 cases in a school, actually we're probably quite unlikely to find other cases. And also particularly children are very unlikely to be the index case. They are usually, they've usually caught it from somebody else in their household rather than being the first person to get the infection. So for those reasons, that's why we're not routinely doing antigen testing in schools.
So Liz, just to follow on from that, so if a teacher had tested positive from a school, would that mean the whole school would close down?
No, it wouldn't necessarily. So if the arrangement we've got in place at the moment is that if any member of staff or a child tests positive in a school, then the school let both the local authority and Public Health England know. Public Health England will then do the risk assessment with the school, and based on that risk assessment give some advice about whether generally it will be the bubble that's required to self-isolate rather than the whole school. But actually in some of our very small schools, the bubble might be the whole school. So only in those circumstances would the whole school be required to self-isolate. Of course, if we then get a second infection or a third infection in different bubbles, then we would have to revise the risk assessment, and potentially under those circumstances we would, the advice might be that the school isolates. But generally, certainly at the moment, I think in the very small number of cases that we've had in schools, it has just been the bubble that's been required to stay at home.
Thank you, Liz. Now then, councillors, anybody else like a question? I'm seeing one from Leslie. So carry on, Leslie. Okay, who's it to?
Jeff, I haven't asked for a question. Wendy has.
I thought it was your hand. Sorry, it was
No,
Wendy's
sorry.
hand. Okay, well, your two screens are adjoining.
Thank you, Chairman. It is a question for Daljit. I'd just like to know when she would she be able to give an idea when officers will start to make outside site visits to meet with councillors on site?
Thank you, Councillor Patterson. This is an issue that has been raised a couple of times by members, and what I've asked the executive team to do now is to just look at this with a bit of a sensible approach, because obviously for a period we were in absolute lockdown and it was very clear. I think now that, depending on the necessity and there may be a disagreement, but how essential it's felt for that arrangement to be put in place, we, the executive directors, the members of staff need to consult with the executive director to make that arrangement. And as long as it's safe to do so and it's safe social distancing, we will start to get some of these arrangements back to normal wherever we can. So over the next week or two, different aspects of the services, whether it's planning or whether it's some of the local service aspects, we will be looking to arrange. What I would say, it's probably easier if any member has anything specific where they have struggled to either get a response on an individual item or issue or an individual visit, if you just drop me an email and I'll make sure that we take a look at it and come back to you as soon as possible. I know one or two members have raised this through their contact officer as well, so you all know who your contact officer is, but I'm happy for you to just drop me a line and we'll have a look at it and get it up. And we can't guarantee it'll always happen, but what I have said to the team is we need to facilitate that as often and as safely as we can.
Thank you.
Thank you, Daljit. Now, I think there is a question, Leslie. It was your hand this time.
Yeah. Sorry, I've just been mulling over the comments made about the school bubbles and if there were infections reported. I'm sorry if I've got the wrong hand on this, but if anybody in a school, if the bubbles, they had to be isolated, what would the knock-on effect be, and how would we deal with possible children then that are actually at school because of key workers? If they were then told that they had to self-isolate, how would we get around that? I'm sorry if I've overcomplicated it. Tell me to shut up if necessary.
Well, I suppose we would, the bottom line is that they would be required to self-isolate. The fact that they're the children of key workers is a complicating factor. But I think it's something that the parents would just have to manage as best they could. I mean, clearly, it will have an impact on a very important sector of our population. But, fortunately, in Northumberland, that hasn't had to happen very many times.
No, it's not been raised as an issue or a particular challenge recently. In relation to that.
Yeah. Thank you. It was just a question. Thanks.
Thank you. I can see Susan again. Is there anybody else at the moment? Okay, Susan, you can have another go.
Sorry, I just want to come in. I wasn't aware at the beginning that we were dealing with both the recovery and the initial plan. So I just wanted to come in a little bit on the recovery. I want to really ask one question, but also just make a comment about how I think it's sort of in the report around recovery, But for me, the economics and the health and social well-being absolutely have to go hand in hand. And the economy of our county will not recover if people don't feel brave enough or well enough or secure enough to actually engage in it. So I just think it's really important that when we talk about recovery, we put health and well-being front and foremost, actually, rather than as an afterthought. I think the issue that has been raised around bereavement for people and recognising the experiences that people have gone through is going to be really important afterwards. And every one of us sitting in this meeting have got a different experience of what's happened, and that will just be magnified across the county. I would also like to see within an idea of recovery some thought given to our care sector, and the fact that we have seen where there are weaknesses, where there are threats to that sector. And I think, you know, going forward, recovery as a county needs to maybe be thinking about that and the people who work within that sector as well. And likewise, I think we have come to the right place in terms of recognising that we cannot lose what we've gained through our engagement with the community and voluntary sector, and that needs to be part of that recovery as well. I suppose in terms of the economic side of it, I would just raise the issue for me looking at this, that there is a lot of focus on tourism, which I can understand, because tourism is a big part of the Northumbrian economy. It is only part of our economy, and there wasn't a lot of mention of it with any detail in it, in the same way as around tourism, around some of those other things, manufacturing, food processing, things like that. And actually, I'm not seeing a great deal of emphasis on those small businesses in the southeast, where you are much less likely to be involved in leisure and tourism as your occupation. And I suppose my question is the thing that isn't in there that puts a challenge to all of those things, but I think particularly agriculture and fishing, is where are we figuring in the implications of Brexit for those that economy as well?
That sounds like questions for you, I think, Daljeet, to either handle or pass on.
Yeah, I think just a couple of comments from me. I totally agree with Councillor Dunworth. I think what I'd like to say is this was almost a sort of starter for 10 to start to have the discussions, particularly with members through the scrutiny committees and the wider arrangements, because I think, you know, none of us have the answer by ourselves, and it's only by talking with the different sectors, using our business support functions of regeneration and with our linkages to advance. And, we've been doing things that we wouldn't normally do. I had a discussion, a roundtable with the CBI last week, and we had a session with the Northumberland Chamber of Commerce. So there's a lot of background work ongoing around a number of aspects of economy, health and well-being, and social well-being too, and social care, etc. And I totally agree with Councillor Dunworth. You can't look at any aspect of this in isolation, but also if you try to broaden it out too far, you almost become too strategic and lose the emphasis of each of those work streams. So one of the reasons for bringing these reports to scrutiny are for each of the scrutinies to think about where they fit in terms of scrutiny of the plans and giving advice and support to how we take things forward. I totally acknowledge that we must have gone 10 weeks without Brexit being mentioned. It's almost unbelievable, isn't it? But it's always been there in the background, and obviously now with the talks, etc., we as LA7 chief executives and actually LA12 chief executives, and the other group I'm involved with, which is the County Council Chief Execs Network, CCN, we're having some of those discussions, and our economic directors, so for us, you know, all of our executive team are centred to this, but Julie Emma is leading for us in a very holistic way, a piece of work. We've had discussions this morning around employment, you know, cross-sectoral employment, the whole linkage for us to our plans around apprenticeship, traineeships, academies of specialist training and skills and enterprise. So behind this, there is a lot of work going on in a prioritised way. And what I would say to you is we'll bring that forward in a prioritised way, so that we are setting out, you know, our response to issues, local issues around Brexit, which, you know, and I totally agree, although tourism is a key sector for us, it's one of a quite widespread number of sectors, and it's important actually that not just that big sector, but actually some of the very small sectors that we have, but really forward thinking around energy, around science, around business development. There's a whole set of work ongoing. And we will keep Scrutinies and obviously Cabinet informed of that around decision making. Got a number of bids in process right through to government, through North of Tyne Combined Authority, through Borderlands. So we are very well placed to pursue those. And I'll ask Julie Emma to pull some of that together to give members further information. And maybe what I'll do is send out a bit of a note in either this week's or probably be next week's Chief Exec's bulletin to members, just so you can see some of the stuff that's going on. And then if you have any particular queries, as always, just drop me an email or we can, you know, have a chat about it.
Thank you, Daljeet.
Can I just say, Chair, can I just say,
tourism, what have you? Sorry, Susan, were you saying something?
Yeah, can I just say, following on from what Daljeet said there about, you know, the different scrutiny committees, I think for us we need to be saying something about the care sector in terms of recovery. I mean, even if you just look at the economy, the main form of income in Northumberland is from the health and public sector, not those other things actually. And I think, you know, we need to be thinking about the workforce planning and delivery methods, whatever, within that going forward, if we want a vibrant, wealthy economy.
Sorry, can I respond to that? Because I
think Nick wants to speak as well.
Yeah, it was just on the specifics of the care sector, because I forgot to cover that off in Susan's question. As you're probably aware, I'm in North of Tyne of the 6 work leads. I, along with Joyce McCartney from Newcastle Council, am the lead for the inclusive growth work stream. One of the big pieces of work that we've actually got on is around the care sector. Actually, for me, clearly, Northumberland is the priority, but that is a cross North of Tyne work stream lead. And we've got a major set of proposals coming forward around the care sector, because as Councillor Dungworth says, it is not just one of our biggest employers, but, you know, our older population and cared for population is significant. So it's absolutely covered, and I just wanted to say that. Thanks. Sorry, Nick.
Did you want to add something, Nick?
Yes, if you wouldn't mind, thank you, Chair. Just to sort of add an administration's perspective on the economic recovery plans. I think obviously the care sector is very important, and you know, there are sort of other sectors that we need to focus on. Tourism, I think, is the second biggest employer in the county, and but it's one of the areas that's been hardest hit, because tourism businesses have closed down completely, so we do need to focus on rebuilding those, and particularly I think for rural areas, because often they are the only businesses in a rural area. That's not to say that we won't be focusing on other areas, and there's been a huge amount of work going into offshore energy and renewable energy in the southeast corner of the county, and that I think that's where we'll get the largest numbers of new jobs. if we can focus on those areas, and we've got sort of pharmaceuticals where the county is particularly strong, and if we can attract new businesses and attract the existing businesses to invest further in expanding employment in those areas, we will become a more prosperous economy. There's been a huge amount of work done by officers, and I think it's worth recognising the work that the Revs and Ben's team, the IT team, and the finance team have done in getting grants out to businesses, over £85 million to over 7,600 businesses. And in some cases, that money will have kept those businesses afloat. And then on top of that, there's a lot of other support available, the furlough scheme, the self-employment support scheme, and quite a number. And then obviously the more recent support announced by central government for hospitality businesses and the changes in the VAT regime. And it's also important that we continue with some of the capital investment projects, and because they will pump money into the local economy, they'll create jobs, and they'll also underpin our infrastructure, which is so important to keeping the economy moving properly. And it's also important, Daljit mentioned working with the North of Tyne and the borderlands. We must do that. We must make sure that Northumberland gets a good deal, as has happened so far from both of those projects. But we've got to have projects ready to pitch into government. There's going to be a huge boost in public infrastructure spending. The Planning Commission for the dualling of the A1's just gone in. Just this morning, we've had confirmation of £1.5 million into flood schemes in Hexham and Ponteland, and so we must make sure that we're ready to take advantage of all that. But there is a really strong focus. The Economic Recovery Board is doing some really good work with officers from right across the council. Thank you.
Thank you, Nick. Can I either ask you or Daljit, tourism, which you expect me to talk about, because that's certainly the biggest employer in my ward. We've seen a huge increase these last few weeks of people coming out to places like Amble, for example. I was down at Amble at the weekend. It was like the height of summer. It was chocker. There was people everywhere. And the toilets were closed at 4:15. The toilets are inadequate anyway. And I know we're spending money on several places like Sea Houses and Holyard, but if we're expecting more and more visitors to not go to places like the Metro Centre, and probably not go to cinemas, and probably not go to museums, where are they going to go? I would suggest it's going to be the beaches, the coastal places, and the parks. And I know we're not popular when I talk about toilets, because I know it's an issue for us, but it's something that we really need to get to grips with. I'm getting awful reports about horrible things happening that people have to clean up in very, backs of toilet blocks because we're closing them so early. This has got to be part of our plan to recover for tourism as well. So
yeah, I think at risk of sounding flippant, you're pushing at an open door there. I think we do recognise the importance of toilets. We are probably one of the only local authorities investing more in public toilets. Can I suggest that you pick up the specific example of Amble with Glen? But you're quite right. I think the tourism economy in Northumberland has a big opportunity. Fewer people will be going abroad. We must make sure that the infrastructure is there to support that. And certainly in the area I live in the West, holiday lets have seen big bookings, bed and breakfasts have seen, it's coming back very quickly. So we must make sure we're well positioned to cope with that. But I'll pass that on to Glenn and ask him to make contact with you.
I'm sure Ajit might say something as well, but just before you come in, can I just say the other thing that's happening when we get all these visitors, they're not going to the cafes and they're not going to the pubs to use the loos, which a lot of them used to do before. So it's actually made the situation worse. Now, Daljit, sorry.
Yeah, Jeff, Chairman, I can totally understand your point of view, and this is probably something that, you know, I've had quite a number of member disagreements on, so I'll just say what I'm going to say. From my perspective, the safety of the staff and the public absolutely come first. So what we've done is very carefully, through local services, set out a number of risk assessments around all of our public facilities, and obviously toilets, whether they're toilets, car parks, recycling centres, you know, the list is endless in terms of risk assessing and getting appropriate service. You know, we've taken very careful public health advice, and I have authorised the gentle opening of public toilets, particularly because, you know, with discussion with local members about that and being mindful of people holidaying and coming out and encouraging tourism. But you know, we just need to be mindful that we're still in a situation of a significant national crisis. So I could totally take on board your comments about getting things open, you know, whether it's 7/7 or whatever, but, you know, we need to ensure the staff have a proper risk assessment. We're mindful of public safety. You know, I don't want people doing things in public places that they really shouldn't be, but I also don't want to be seen to be encouraging a sort of mass opening of facilities and saying that everything's open, come here, because you actually said it yourself. It's like the height of summer. Now, you know, as long as it's height of summer with 2 metre social distancing, maybe, but we just need to be mindful of the messages we send to the public. On the issue of amble toilets, absolutely, I'll check that out with Rick O'Farrell in terms of local services and see if there's something more we can do, but I couldn't just not comment on that one. Apologies.
Thank you very much. Thank you very much. Is there any other questions? We've been on this a long time now and we've got a lot more to get through. I can see most people. As anybody else who I can't see, or if you want a question, please indicate now. Okay, one more. I've lost your name. Councillor Bowman, sorry.
Yeah, thank you, Chair. Can I ask about the second wave? This is a conversation that's going on at the moment. Some experts think that the second wave might be in the winter time, but we don't actually know. Are we going to implement tougher sanctions, lockdown, bring in, like it was at the beginning, if a second wave does come? And what about education? What about the care sector? Are we going to implement a tougher stance if a second wave does occur? Thank you, Chair.
Chair, shall I take this
Yes.
one?
Yes.
I think it's really difficult to preempt when a second wave will arrive, or even if it will arrive, and if and when it does arrive, you know, what the impact will be. I think that just reflects the uncertainty around this infection and the impact that it's going to have in the coming months. I mean, clearly the worst case scenario would be a significant second wave coinciding with the regular pressures that we have over the winter. What we are doing is really focusing on flu vaccination this year in a way that we've never done before. We're doing that both because we recognise that we don't want people to be having flu at the same time as a possible increase in the number of new infections of COVID-19. So we've always had a flu board, but this year there is an integrated care system flu board with 8 task and finish subgroups, which are looking at how we can really effectively deliver flu vaccination in the current climate and with the current constraints. And we've also got a Northumberland flu board, which is looking at how we do that locally. I mean, in terms of a return to lockdown, I guess that will, be very much driven by central government, if this is a national second wave, and it's probably not going to be a localized one if we do get one. In terms of local lockdowns, that will really be driven by any sort of local increase in transmission, and that's what we're really keeping a very close eye on. So both my team and Public Health England scrutinise the information, the data that we've got available on a daily basis, to really look for anything that might indicate that the number of new infections are increasing. But I mean, it is very difficult to try and predict what's going to happen over the next few months, but we just need to be prepared for all eventualities.
Thank you, Elizabeth. I think we'll call this section to a halt now, and we'll move on to COVID-19 update. So Jim, do you want to open up, or is it Siobhan who wants to start the ball rolling on this one?
Hi, it's Siobhan here. I'm very happy to.
Okay.
Okay,
yeah.
Jeff.
Yeah,
so
go ahead.
Between Jim, Alistair, Jeremy and Kate and I, we're going to take you through the health response around COVID. So from my and Kate's angle, we're going to take you around the primary care response, and also we're going to have a real focus around mental health and the potential for more cases around mental health going forward and how we're going to tackle them. So you have all of the presentations in front of you, but there's 5 key messages really from a primary care perspective that I want to share with you. We have 41 practices here in Northumberland, which are all part of primary care networks. And COVID has been an incredible opportunity for primary care to really work in those networks together and have really strong business continuity and manage any issues that they've got within those networks. And those networks range from a population size of 30,000 all the way up to 80,000. So that's been phenomenal. I think they've really found their day, and we hope that going forward they will just get stronger and stronger. And in those teams, you have social care in there, you have volunteers, the whole of social prescribing. So a really, really integrated multidisciplinary team alongside all of the health services. The second part of our response to COVID has been very much not only around the delivery of primary care, but around care home support. We've heard a lot of that already from Daljit and Liz and Kath. But from a primary care perspective and acute, really wrapping around to support training, infection prevention and control, medicines, and GP and medical alignment around those care homes. We've commissioned at least 12 new services over this period as well. Kate will take you through some of those mental health ones. In terms of volumes that we've seen, what's been really interesting about that is from March to April, we saw really significant drops in the volumes of people contacting primary care. Usually we have about 165,000 contacts a month, and they dropped over 30% by April. What was really interesting for us was the number of face-to-face appointments, as you can imagine, dropped significantly. But in terms of our telephone appointments and digital appointments, they increased by over 60%. So in terms of future learning, I think adding in telephone and digital solutions will be really big. But we do need to make sure there aren't unintended consequences for that with people who aren't necessarily tuned into that whole digital agenda. We are already starting to see the volumes increase, and I'm sure when Jeremy, Jim and Alistair talk, they'll talk about that as well. There's a kind of coming back to normal going on now, and we want to make sure that we're picking up everybody who didn't present during COVID. So picking up all of those things around stroke and cancer, immunisations and so on are really important for us. The biggest tasks we're doing now is getting ready for the year ahead, bearing in mind all of the infection prevention and control that we must have in place. So we're looking again in those primary care networks about having sites that remain what we call the hot sites, where people with potential COVID come, but then others where other people can come, but keeping that transformation around digital and telephone as well, very, very strongly. So I'm going to hand you to Kate now, because there's quite a lot we've done in mental health that she will take you through. We've definitely seen a real amount of mental health issues coming through alongside domestic violence and safeguarding, and we've thought really carefully about our response to that. Kate?
Siobhan, just before you pass over, can I just say I'm getting a lot of noise, breathing noise from somebody. I don't know whether it's one of the people that's got the headsets on.
It's Jeremy Rushmore. Jeremy Rushmore, I think.
Okay, well, whoever it is, if you're not on mute and you're not presenting, please put yourself on mute. Thank you. Carry on.
Thank you, Chair. Can I just check that you can hear me all right?
Yes.
Okay, thank you. I've had a bit of a technology glitch myself today. So thank you for having me here today to talk about the mental health and disabilities response to COVID and the new services that we have commissioned to deal with the anticipated increase in low-level mental health concerns and increases in more complex presentations. So I know that you've got the Excel presentation in front of you, but if I can just talk you through some of these points. So all of the mental health and disability services have seen a significant increase in the use of digital technology for group work and one-to-one appointments. So we are seeing increased referrals into all of our pathways, but we're able to cope with that demand because people are being seen using things like MS Teams and Zoom. The CCG has commissioned Couth, which is a digital platform for children and young people, and that went live on the 22nd of June, and that provides low-level support and information for children and young people who may want to access counselling, group support, or information around common mental health problems. Since it went live, we've had 76 children use it 276 times, and this is particularly good news for the rural areas where children would have had to travel in to see people. This is very accessible, and it's been well received in Northumberland. We've made emotional and wellbeing support available to all care home staff through Mind in Northumberland and through a national line that Cumbria, Northumberland Town and Weir Trust have set up, and this has been well responded to and used. We've also supplemented 2 of our additional counselling pathways for adults and children, and there are currently no waiting lists for children in these pathways. In preparation for school, we've set up with the local authority a rapid triaging hub at Foundry House, which will receive referrals from professionals and children who are concerned about their child's return to school in September. This will enable us over the summer holidays to get the correct response in for individual children and support schools. With the support of Northumbria Healthcare and the Mental Health Trust, we've introduced a children and young people specialist 24/7 into the adult psychiatric liaison team at NSEC, and this is particularly to support children and young people who may present with a psychiatric presentation or deliberately self-harmed. Since we put that in place 6 weeks ago, we've seen 61 children and young people in this pathway, and we've prevented 3 admissions to the Tier 4 CAMHS units. We currently don't have any children with a learning disability or mental health problem in psychiatric hospitals. Our 24/7 all-age crisis service went live, and this includes the older people's pathway for people with dementia and other organic psychiatric concerns who were not included in the service beforehand. And we have set up a mental health emergency department, a MED, at NSEC to divert people with mental health presentations out of NSEC and the emergency room. Our IAPT contract was due for renewal in August, but because of the impact of COVID, we have extended this contract for further 12 months, and we have commissioned additional support of 2 experienced locums to help support people who need more complex mental health treatment, including cognitive behavioural therapy, or people that are frightened of coming out of the house because of COVID, and they have started to work now to reduce weight in that pathway. I'll just pause there, and then I'll move on to learning disabilities, if that's okay with you, Chair.
Okay, you're a very important person. We can see you twice.
Can you?
Yeah, we've got two screens.
Oh. Do I look the same on both?
You do, but unfortunately, you're not interfering with each other as well, which is good. I mean that in the nicest possible way.
How strange.
Yeah.
So,
carry on, please. Yeah.
For learning disabilities, so this is a particularly vulnerable group, not only because they will be in the main shielding, but also because they are vulnerable to changes in the people who are providing their support and at risk of placement breakdown. So the CCG has commissioned 2 safe havens with one of the local authorities' trusted providers to provide 24-hour support to individuals in a crisis with learning disability, autism or both. We've also commissioned from the same providers some peripatetic support, and being able to deploy these staff has prevented 3 people with a learning disability needing to access mental health hospitals over this COVID period. We've commissioned a service called Keeping People Connected with 2 of the local authority self-advocacy groups to support for people with a learning disability or autism who are currently not known to or entitled to existing statutory services. And this has been well received, and they've seen and spoken to over 100 people during this period. Annual healthcare checks, which are vitally important for adults and children with a learning disability, we're now setting up that they will be completed virtually, and this will support the flu campaign later on in the year. And in partnership with the local authority, we continue to work hard to make sure that there are timely discharges from both the acute hospital and the mental health hospital for people with a learning disability or autism who don't do well in this environment. And we've managed to avoid any inappropriate admissions at this time. Thank you, Chair.
Okay, thank you very much. Back to you, Siobhan.
Chair, would you like Jeremy, Jim and Alistair to present and then take questions all together on health?
I think that would probably be the best idea, yeah.
I think Jeremy's got the slides, so he'll come in on that.
Yeah, that's it. Hello. I've managed to get my microphone off. I'm going to try and get you all back up again. Can you hear me?
Yeah, I can hear you.
Sorry for the heavy breathing. Sorry for the heavy breathing earlier. I was just desperate to get in. I'd switched my microphone off mute. You caught me out. So we've got a large number of slides, but I'm going to romp through them just safe in the knowledge that hopefully you'll pick up the conversations you want to have at the end. But I just want to take us back. It was around the half-term holiday in February, thinking about where we were when we didn't know what was going to hit us, and things in northern Italy were just starting to warm up. And what we were asked to do was to prevent the health services in pandemic from being overrun. And if you remember, we had a CPG which Liz and Wendy Burke, her colleague from North Tyneside, came to talk about our pandemic preparations. And there was lots of modelling done at that time, but we were talking in some of the estimates of deaths getting on for 200,000 or 300,000, and it was very uncertain what was going on. And it was around this time that we got a long and formally worded letter from NHS England and Improvement, setting out the actions that we needed to undertake, which was really all at that stage about freeing up the maximal inpatient capacity and sorting out critical care and ventilators. I can remember a series of conversations I had coming back saying we could ventilate 44 people and being told to go away and prepare for more than that. So there was a lot of uncertainty about the size of what we were about to hit, and we were asked to cancel non-elective operations. There was a lot of uncertainty about what you might need to do to protect elective style patients in that sort of setting. We worked closely with colleagues in the council and community services to speed up the discharge of patients from hospital, and to look at, in particular, our ability for level 3 ventilatory support, looking at the amount of oxygen, the critical care bays, and having an adequate supply of PPE.
Jeremy, while you're taking breath there, we've got a lovely photograph of all the time of your left shoulder.
I'm sorry, it's because there we go. I'm having to read my slides. They're on paper.
Okay.
Is that better? So we also needed to support the staff and maximise their availability, stress test everything to make sure that it was ready, and the CQC, thank goodness, stopped visiting. So actually, by shutting down elective activity, moving quite a proportion of surgical activity to our base sites, putting up fractured hip services at Wansbeck and general surgery at North Tyneside, we were able to sort out an awful lot of capacity and change the pathways and trained staff coming back into potentially critical care in very short order. Huge shift to digital communications and telephone clinics for outpatients, and the creation of COVID light sites. We worked very closely with the North East Critical Care Network. There were chief executive daily calls. Myself, our nurse director and chief operating officers, we all met every day. We kept in close collaboration with Newcastle, and at this stage there really wasn't that much testing capacity in Northumbria. There was some testing capacity, first of all in Newcastle, then Gateshead, and we've had testing capacity. We didn't get testing capacity until well into April, although that is now in a much better state. So I just think some of the headline numbers, so if we look at what happened from the 18th of March to the 5th of July, we admitted 27,000 admissions, irrespective of their COVID-19 status. During that period, 771, that is 771, not 7,071, that's 771 were confirmed with COVID-19. Today, we have 5 people who have confirmed COVID-19. And during that period, we discharged 589 live discharges of people with COVID-19, and there were 198 deaths, with an approximately similar number of deaths in community settings, principally in care homes in Northumberland. There were 300 critical care admissions during that period of time. So of all types, but only 43 of them had COVID-19. In terms of our critical care, there were 25 live discharges and 19 deaths in our intensive care unit. One of the things we were able to do was we do a lot of non-invasive ventilation on our respiratory unit. They had 133 admissions in that time, and around almost half of them were COVID-19, and they had 42. So that's about 60%. 42 of those survived. We started off because we did have a lot of people went home at the beginning of the pandemic, and so we lowered our length of stay, but that has steadily risen. And when we look back over the curve of the pandemic, our curves are much like the national curves or the and also the Northeast curves. We hit a peak around the Easter weekend, and really since a plateau going most of the way through April, cases have steadily declined all the way through May until they've reached quite low levels. Our admissions fell, our attendances to ED fell from about 600 to 250 right at the start of the pandemic, but that's gone on an exponential rise, and we're almost back to pre-pandemic levels, with about 500 people attending across all of our sites. we've, if we look at what's happened in terms of care homes, during the period, the same period that I was discussing earlier, we had 1,100 discharges, of which 168 so 1,100 discharges of people with COVID-19, of which 168 or 15% were to care homes. So by far the majority were people who were discharged back to their own home. And of those people who we discharged back to home, who had coronavirus, most had been in for about 2 weeks was our mean length of stay. So these are people who'd been in our system for quite some time. So I've sent some, we've included some data on the risk groups in terms of mortality, I just find the impact that age has upon your chances of dying if you're a member of the public to be very, very significant, and probably the most important single factor in terms of your risk. But of course, we do know that it's hit our deprived our deprived populations very much worse than everywhere else. So in our conurbations around Blythe, Cramlington, and down at Wallsend in North Tyneside, we've had that's where a number of the deaths have been concentrated. But if I could just take you beyond the, so talking about excess deaths, we've got the data for Northumberland's excess deaths, which, so for the first 13 weeks of the year, so that's to, I think, about the last week of March, we had approximately below average deaths in Northumberland. And it's been about an 8-week period where we've had excess mortality, with a spike across weeks 14 to 17, with most of that excess being explained by people where COVID is mentioned on the death certificate. So they're either positive or they have the clinical syndrome. But since that time, the average deaths within the county have fallen below normal. So on week 25, right the way across the county, there were 40 deaths, whereas last year there were 65. So it is entirely possible that that spike in terms of the hospital numbers was only about 3 deaths more at its peak than the flu incidents that we had not this year in 2020 but in 2019. So whilst there have been a large number of deaths and there have been quite a number in the community, probably that's where most of the increases occurred, they have quite quickly returned to normal, but it's been only a little bit worse in terms of the total numbers than flu from a hospital death perspective. Both in Northumberland and North Tyneside, we've really had fairly normal patterns for admissions from care homes, but when you look at the different hospital performances, and there have been articles in the paper about how different trusts have performed, there are quite considerable variability in how patients are admitted to hospital. And of course, it's really important to interpret the whole population mortality rather than just focusing on particular care sectors, because they will affect the numbers. So during this time, we've moved an awful lot to telephone and video consultation, and we've really appreciated, and I hope patients have, the fact that we've been able to see about 8,000 people in non-face-to-face appointments, and so the miles less travelled for the county has been very, very significant. So all the way through this, there have been a number of tensions, and some of those remain. So the modelling has always been a tension. I have, if anyone tells me they know what is going to happen in regard to the a second wave, or whether we'll bob along, I just don't really yet believe them. I'm not sure that we know. We do definitely know much more, but the science hasn't always been able to tell us what has happened. Sometimes our best guesses have been better at that. So there has been reduced access. There's been a 50% reduction in daily ED attendances throughout, and a reduction in admissions. We have major concerns for those not accessing services, and I think now is the time to talk that the population risk is not all about coronavirus. In fact, I think today it is probably much more about other things such as isolation, the economy, which we've already been talking about, cancer, heart disease, and all the normal things. If we hadn't set up some manufacturing of PPE ourselves, there is no doubt that we wouldn't have been able to protect staff and keep them safe in the way that we have done. And so that's been a tremendous benefit to our local economy. And I'm very, very proud at the way Northumberland and North Tyneside was able to stand up and support itself in terms of PPE. The testing really hasn't sorted itself out. We're in a much, much better place than we are, but there are pillars. The various pillars of testing mean that we haven't had access to all of the data that we've required, and all of the capacity that has been purchased in pillar 2, when we probably still don't yet have enough capacity in pillar 1, which I think is, as Liz was saying, where we can get the results and the results of the tests out quicker so that we can actually get people treated. And this has led to a lot of confusion. There's been lots of mixed messages, and there is an awful lot of anxiety out there. So we've got a slide with some more detail on the testing. I won't go through that. We're probably finding at the moment that most people who have come in with coronavirus and we've admitted have gone home basically well. We have a very small number of positive patients in a day. We're finding about 3 to 5 positive cases per day, but that does include some of the staff testing we're doing. We think the whole system has come well together. We've worked in concert with colleagues in the local authority, the CCG, as well as Newcastle. We have continued colonoscopy, cancer diagnostics, and urgent operations all the way throughout. And we're really looking to have a really good go at building up access to services again. And we need help reaching out to give people the confidence to come and become safe. So we feel we've done well in terms of the actual outcomes and the number of patients surviving critical care, the mortality per head of population. The Northeast has done relatively well. I think it would be true to say that in terms of the first surge, we've done okay in the Northeast. We think we managed the preparation and the surge well. I think that really stands us in good stead for whatever comes at us through winter, although it is clear that this time we are going to need to maintain access for non-COVID all the way through. We've made, there's been a huge amount of transformation undertaken by the staff, and that's been a really, really important thing. We've managed to maintain our ED performance, and we had a weekly staff feedback mechanism. So we've been looking at what's been concerning the staff and managing to respond to it all the way through with some really good and reliable messaging. So we're now really looking forward to recovery and restoration and getting back back to normal. We're working together with all of our normal partners. At least part of our recovery is reliant on us maintaining access to testing and PPE availability. All our elective work is being done with pre-op testing and isolation. We're getting ready for a potential in our ED emergency attendances, and I think we feel that in order for us to make our way through winter, we're never going to be able to get back to the open, to the wide open front doors at the Northumbria that we had prior to the pandemic. We're really supportive of testing and tracing. We're working hard with our staff, and we want to know about local flare-ups so we can help manage them. We want to work and support the care homes, and we've increased our infection control staff in order to do that, and we want to have joint communications and try and move forward as a health community. Really, I just think pandemic has had, there's something very personal about living through this, whether you're staff or a patient. So all the people have been absolutely magnificent, but the staff, we couldn't really have asked more. They've been incredibly flexible. It's felt really privileged for us to be a health provider, to work with such excellent providers. There's lots of evidence that the public support for the local NHS and the local services has absolutely held up and probably grown throughout the pandemic, which is really humbling, and we're really grateful. There's a real sense of community here in the Northeast, and it's been absolutely out of this world. And I think the opportunity is for us to learn from this and to build our future working together from this. But I think our chief message is to try and get back to restoring normal access for care for those who need it. But we'll be keeping a weather eye on everything that goes on, and looking to respond in whatever way we can. So we just wanted to say a big thank you to everyone who's been part of it. We couldn't have done it without you.
Thank you, Jeremy. Do you want to say anything else, Siobhan?
No, just happy to take questions.
Well, I've got one more an announcement perhaps from you than a question. I'm privy to what happened with Rothbury. Now, it's not an issue, but as the councillors have been involved in Rothbury Hospital over the last few months, I think it'd be very good if you just give us a very quick update concerning the letter that you sent me about temporarily closing the bed. So please carry on, Siobhan. I'm sure you can answer that.
Okay, so what we've done an analysis and an assessment with the Foundation Trust about COVID and about winter coming up and the potential of a second wave. We've done a lot of work with Rothbury and a lot around the model of care, a lot around the staffing, and there's quite a lot of figures about the usage that we've got. In terms of the flexible bed model, however, we do feel that we need to just take a break to manage winter, to manage COVID. We've engaged very, very closely with the campaign group and others, and we'll continue to use Rothbury as effectively as possible, but we are putting that on hold until spring. In terms of the campaign group, they've written specifically and backed the recommendation, and we've also debated it at the clinical commissioning group as well. So that's the current position going forward.
Thank you, Siobhan. And I'm aware of that. I know that the councillors and the pressure groups who've been talking about this before are fully aware and content, perhaps not happy, but content as to what's happening with that. Right, so questions. I see Susan again. Carry on, Susan.
Thank you, Chair. Again, thanks for those reports, and thank you to all the staff involved. I don't think it's an accident that actually our figures are awful, but I think in comparison with other areas in the country, particularly those with a similar demographics as ours. I think we obviously have managed to contain this disease as best as possible, and I think that is down to the work of the trust and also the work of partners working together, because we do have an old population. We might not have the inner city living, but we have other issues around deprivation. Do people still hear me?
Oh yes.
It's just everybody else is frozen. And I am particularly pleased to know that we carried on providing urgent and cancer treatments, because there are neighbouring trusts that have not done that, and where all services, all diagnostic services have ceased for the last 4 months and are only just starting. So I think the trust deserves a huge amount of credit for actually maintaining that. I've got a couple of questions. One is around, it's for Siobhan probably, and I'm just interested to know, and I think I probably asked this before, but it was at a very different stage in where we were, and that GPs have routinely just been keeping in touch with those patients who are on the very vulnerable end of their spectrum, and not necessarily involved with services. So people who are 80 plus, multiple health needs, whatever. And then a question that is probably Jeremy, but possibly could be anybody. And that is, I share those concerns about the testing and the weaknesses that are still there. I'm quite concerned about the limited opportunities for testing within Northumberland itself, compared with, say, Newcastle. And when we look at those groups that are most at risk from that, they are the ones who may struggle the most to get to tracing centres further away, and also to do home testing that's worth anything. So I'd be interested on your views and whether we can do anything to push anybody to make that happen better. And I think just sort of, well, two things finally. One is, I think it's pushed all of us this to work in different ways. And I think to some extent the health service, it was a bigger challenge for the health service and trust within that because of the size of the organisation and sort of the history. Local authorities have got good at being chameleons and swapping and changing and moving on. So I think that credit there. My last point from this scrutiny is we continually get reports that say things are worse because of people who live urban areas, people who live in areas of deprivation. And I suppose it's a challenge that what are we going to do about that? Is it continually going to mean you are more likely to die in certain areas that we serve? Or are we actually going to seriously try and come up with something that changes that for people? Thank you.
Thank you, Chair. You happy for me to? I think I can answer two of those for you, Councillor Dungworth. I might also bring Alistair in as a GP. In terms of shielded patients and very clinically vulnerable patients, it's fair to say at the beginning when the national algorithms generated the lists, there's quite a lot of confusion in the system about who's on it, who's not on it, what you trust in terms of transplant patients and so on. All of that, and every practice we did it in a really pragmatic way, and Alistair can maybe talk you through how he did it, but we literally every practice sat down and looked at their most vulnerable clients, including the patients who are on the list that came down nationally, but also others who might be in those vulnerable groups for us. So at any point in time, even though people weren't accessing a lot of services, if we thought patients were vulnerable within our patient groups within practices, we would be approaching them and trying to work with them as effectively as possible. Alistair, I don't know if you want to comment on that.
Yeah, I think with those patients who are shielded, they've all had supportive calls from practices. They've gone through the lists on a very proactive basis, and when some activity, and it tends to have been the nursing long-term conditions activity, because that was something that could safely be paused for a short time, the nurses have actually been doing that extremely effectively. I think that is going to continue throughout this month, but will then tail off as the shielding tails off. And I think then if we get any local outbreaks or any lockdown situations that happen in a particular area, that will pick up. But we also then need to move towards some of the long-term condition management. Particularly, these are people who are often vulnerable, not necessarily just because of their age, but because of other conditions, to make sure that their care is monitored. So we'll probably find that it's a segue. So we move from giving them supportive care when they've been shielded to actually trying to get them more active care on monitoring of their current care. And the same is happening for hospitals, so that where outpatients have safely been able to avoid blood tests or monitoring over a certain period of time, that will need to kick back in. So it will just be a graded exposure back into face-to-face contact, bloods, long monitoring. But I think they've actually had a very good support, and it's been clear about the linkage between that and local authorities with regards to the food packages, the support and everything else that those who are most vulnerable have been exposed to. So hopefully that answers that question.
And Councillor Douglas, in terms of inequalities going forward, I think there's a couple of parts to this. There's one, and others can join me because they sit on this board as well, at the System Transformation Board, working with Daljit and Jim and the whole system. We seriously need to look at reversing Marmot. We seriously need to set ourselves those 10-year outcomes. And some of the groups, for example, Kath McAvoy-Carr, who's on the call here today, she leads the whole of our children and the best start in life. We're looking at poverty, we're looking at all the gaps in that. So there's something about us as a system committing ourselves. But in terms of now and COVID and the deprivation that's come from that, one of the things we're doing with the Trust and other providers is actually we need to do some risk assessment on the lists and the waiting lists that are here now in terms of clinical priority, and getting a sense together about making sure that those most affected and those most vulnerable, that we assess and create system pathways for them as soon as possible. So I think there's some short-term work on it, but I also think there's a kind of 10-year commitment we need to make as a system to reverse and Marmot. In terms of the testing question, I don't know the answers to that, unfortunately.
Can I come in on the testing question? Because I think there are several different aspects. One is around the rurality and people accessing the Pillar 2, which is the pop-up services, which I think we do need to look at. The postal access is actually good, and I think will, particularly in a rural environment, have to be the way forward for lots of bits, and is still working very well for care homes and at-risk bits. Our hospital capacity hasn't been stretched within that. I think this is more about the logistics, and I think what we need to look at is how often we're going to need testing. At the moment, the rates are low, so that it's quite hard to get convenient sites for people, and I think the home testing might be the right way for people where the rates are very low. As the rates potentially pick up, if there is a second wave, we will need to look at that again. So I think what we can't do is think that there's one site that's going to be convenient when we've got low numbers at the present time. And I think the convenience of the postal is definitely an advantage for our rural communities.
I think you're right, Alistair, but I think it's a bit chicken and egg. So sometimes you might have low numbers because it's so hard to access that people actually don't. And like, there's nowhere in Blyth and Blyth and Cramlington have been, already mentioned as places that were hit hard. If you're talking about areas of deprivation, the impact of COVID is only going to add to those areas and those people.
Completely agree, and Liz will be able to come in possibly on this, but where the Pillar 2 sites, unfortunately, the two schemes have been divorced. So the local, none of us in Northumberland at the hospital or public health or indeed primary care have had any influence over where the Pillar 2 sites have been, and that's all been set up independently, and until recently the data wasn't even available, which it now is. So I think we've got things that have been conducted at pace that haven't always been as coordinated or as sensitive, and I think the more that we can exert pressure around the Pillar 2 sites, which are working independently, to make sure that they are locally sensitive. I completely agree, Councillor.
Thank you.
So, Chair, can I come in on that point?
Yep.
So, with reference to the mobile testing units, which is really the only bit of Pillar 2 that we have some, or we will have some control over, going forward, I think we'll probably have 2 of those mobile testing units, which will be there to support testing across Northumberland. We're doing a bit of work at the moment to see whether we can look at whether the testing uptake reflects need. But unfortunately, at the moment, we don't get information about negative test results. We only get information about positive test results. And we need that negative test result information to get, a view of the totality of the need. Public Health England do get that data. So after we've analysed our own information, I think what we'll be asking Public Health England to do that bit of analysis for us, just to look at where the areas of unmet need are for testing.
Thank you very much. I've got a question for you, Jeremy. I'll always call you Mr. Shoulder from now on, I think. You mentioned the digital appointments and how successful they've been, and how we're looking to perhaps look at them in the future. My own personal view is we should be very skeptical about that. People are doing it because they have to, not because they want to. I think if you ask people who've had them, certainly my circle of friends don't like these meetings, for example, that we've got now. We'd rather have them face to face. And certainly people I've spoken to who've had doctor's appointments also feel the same. So I'll be very careful about making sweeping judgments about how popular digital consultations with GPs are. I'm sure you're aware of that thought anyway, Jeremy.
So I think the main point was we live in a very rural county. People we do know, they travel an awful long way. So travelling down from Berwick to Wansbeck or North Tyneside can take the best part of a day to perhaps only have a blood test and see the doctor for 10 minutes. So I think the point was being made about miles less travelled. We are very much looking at how we stratify our offer around face-to-face, use of digital, and we will be conducting some very specific patient experience information to try and tailor which of the offer we're doing so that people get the very best value from them. But I think that there was quite a bit of activity for which patients were travelling, which could be provided in other quite successful ways. And we do have some feedback information that isn't always as you would suggest, but we'd be very happy to see you in person.
I think you're right. Exactly what you just said is right. There's certain things I think you could do digitally. I think there's certain things that you probably wouldn't be doing digitally. Right. Questions.
There are definitely some things you can't.
Okay. Questions from anybody else? I can't see anybody waving at the moment. So if that's the case, can I just say thank you very much for those presentations. I think, as has already been said, I think we've done a good job of coping with a very bad situation. And I think we've done better than most other people have done as well, which is always a very pleasing thing to report. So thank you very much. And with that, we'll move on to Derry, who's been very, very patiently sitting here waiting for her Health Watch 6 month update report. Carry on, please, Derry.
Thank you very much, and very quiet for me. I think we'll all agree that I've been very quiet today. You've got the presentation in front of you, so I'll just whiz through a few points that I'll make, judging on the time. It's divided into pre-lockdown, lockdown, and what happens next. Just a couple of things to pick up from pre-lockdown. We were doing 2 pieces of work. Our annual survey, which I know you all wait for with bated breath every year. So we had to cut short the engagement around that by 2 weeks, but we still managed to get 800 responses. I'm pleased to say we had a much more diverse response this year, both in terms of locality and demographics, and we will be producing a short report which will be coming out to you in the next couple of weeks with more detail about that, and obviously happy to pick up with any of you on that when it comes out. The other thing I'd say as well is that we were very pleased to be able to do the Your Voice Fund, which was a small grant scheme that we did because we recognised that there were some people we weren't hearing from, and we've detailed more about that in our annual report. But what I would say is that it paid dividends in terms of what happened during lockdown, and it particularly helped us engage with and get feedback from some of our Black communities and people of different ethnic backgrounds who are engaged with that particular project. So we were very pleased that we were able to get that project up and running, and it's really proved its worth. So we come to the 23rd of March. Healthwatch basically planned for this. We moved straight away to working from home, and that's what we've continued to do ever since. As you all know, we are a statutory activity, therefore we have to we have to be around, and we took that very seriously. So none of our staff have been furloughed or anything like that. We've worked continually throughout the lockdown period. We moved very quickly because obviously, and this is reflected across the country with health watches, people had other concerns, they had other issues that they were thinking about. We moved very quickly to our signposting and information service, which is one of our main statutory activities. And we put dedicated resource into that. And the sort of issues that we were getting around that were the things that you would expect, which was about the COVID related stuff. So a lot we've heard today about shielding. So we were getting people asking questions about why am I not on the list, or should I be on the list, or what do I do? How do I do this? But also queries about where to get help. So people who just felt very isolated and didn't know where to get help and were being inundated with all this information. So I think what it said to us about that in those early stages was that it is really important that there are that services are able to communicate across the widest number of channels possible, but also with very clear messages, and keeping agencies like ours in the loop really would help with that. In terms of our dedicated resources, where we weren't producing any of our own resources, this was making sure that we only used verified sources. We had 800 hits on that particular page up until early June. We also took the decision to switch our work to doing befriending and support, direct befriending and support services. So we did calls to people who support us anyway, who we're in contact with, who on a regular basis, but we also worked with Northumberland County Blind Association, and basically we became volunteers for them, if you like, and spent and we've only just finished that. We finished that at the end of June, making befriending calls to people with sight loss. And I think that was really interesting, because I think that is a group that was very clearly feeling very much under pressure by this and felt very isolated during the lockdown period. We also set up the Tell Us Your Story, which was about capturing the positives, because we were very clear that there was a lot of stuff and we really wanted to capture what was happening early on, and we got some good things out of that. We launched online forums quite quickly as well in June, because we felt that people were starting to come back in and starting to talk to us about different issues that had been going on with them, and we wanted to capture that and give people opportunities to do that. And we're very pleased that the CCG and CNTW and other agencies have come in and have been supportive around those forums, and there's been lots of useful discussion, especially around mental health. So what happens in lockdown and beyond. As I said, we're not doing face-to-face, and like Daljit was explaining earlier, any face-to-face that we do start to do will always obviously be risk assessed. So we're planning for the long term to do more online, but, and this picks up on Jeremy's point earlier, we are trying to avoid a dash to digital. And it certainly picks up on Councillor Watson's point, is that some of the feedback we've been getting is that people feel that they've used the online digital stuff, but there are some people who don't feel it's for them, or just haven't been able to do it, or just feel very anxious about it. So nationally, as a movement, Healthwatch England and the CQC are doing a big campaign at the moment called Because We Care, and that is about trying to gather people's experiences of services and what they plan for the future, what they want for the future. And I'm sure that will come up as part of that. So I would encourage you to say that if you are coming across people who have had good experiences, or maybe want to feed in their experiences about any aspect of health and social care, feed into us now, and that will then bulk up into a national report by Healthwatch England and the CQC. One of the things that we are going to struggle with, I think, this year, and it's probably worth, because this has been part of our thinking over the last 6 months, is about how we do enter and view, because basically we're not, because we're not going to be able to enter and view anywhere. But as a network, again, it's something we're looking at, but it is one of our statutory activities, so we do have to think about how we might do that in a different way, but it is one of the things that we're looking at. One of the other things that we've been able to do during lockdown, and again, I think it's that thing about working together, using new ways of working, is that we've worked with the CCG around the closure and the public engagement for the laburnum surgery, which you'll all be aware of. And I think we helped the CCG have a very meaningful engagement with patients around that a week and a half ago, which I was very pleased that we were able to do that together. I know that Zoom is a bit of it has to be used with caution, but I think it really did help people to use something that they were used to using in their private lives. So that then takes us on where we're going for the next 6 months. We've also, during this period, we've carried on. We've had a board meeting. We've confirmed and refreshed our strategy for the next year. And we've also set our priorities for the coming year. And this is where I just want to loop back to the annual survey. As I said, you'll get a full report on this in your inboxes shortly. But I just thought it would be worth looking at the snapshot of what Northumberland told us through that survey. And what we have to remember is that it's historic. I mean, it's always historic, but it's even more historic now. It feels like it's from a completely different planet, let alone a different time. But that was the sort of list of the top 10 things that came out of the survey. The GP thing was really interesting. We were still getting a lot of feedback about GPs, but it was a lot more popular, a lot more positive than it was last year. So I think there has been some movement. So Siobhan might feel quite quite cheerful about that, hopefully. Mental health services, there's still a lot being talked about that, and Kate and I are having a conversation in a few weeks, next week, I think, about that. We've pulled out the mental health stuff specifically to look at in more depth in terms of what the feedback is. So our priorities going forward, which we'll be talking about when I do a next 6 months update, is our priorities for this year, so up till June next year: mental health services, looking at the gaps, looking at the services that are coming in and things that are planned, and really trying to use the feedback and the forums and all of those things that we can. And I think the focus of that will be community and low-level services. It goes without saying that we'll be looking at the impact of COVID on patient and service user experience. And we're also going to be looking at a focus on the localities that we hear from less. As I said, we had a more diverse response to the annual survey. And certainly figures came up in the southeast of the county this year, but there are still some communities we don't hear from, and so we will be trying to focus our engagement in whatever form that will be in those areas. And I have to say, in terms of non-digital, we're thinking telephones. That's what we want to do, telephones and village networks. I'll leave it there, and if there are any other questions, I'll pick up on some of the other little bits, but if there's any questions, I'll take them now.
Thank you very much, Derry. I'll start the ball rolling. You talked about the County Blind Association.
Yes.
I don't know really where to raise this, but I've had several complaints or concerns expressed by blind people. The huge increase in the number of cyclists, which I think was something that we've all been working for, is good. But there's been a lot of misuse of footpaths by cyclists who are driving on the footpath instead of driving on the road. And I know personally, if I've spoken to the odd family and I've got nothing but abuse saying, do you want my kids to cycle on the road? And you say, well, yes, there should be. You know, they can imagine the sort of answer that I got back. But I have had real concern for some blind people who are frightened because they rush past them on the bikes, which, you know, you do, and they're not aware of them, and all they hear is a kind of a swish. And I just wondered if you're picking that up.
We haven't during the lockdown period, but obviously I think people haven't been out as much, so I think that's probably the reason. But yes, I mean, I would imagine that is probably a concern that the Blind Association do pick up from their members.
Right. Questions from anybody else? If you indicate, and I can't see you on the screen, if you just chirp up. If we haven't got any, it looks as though you've got an easy run there, Derry. Thank you very much indeed. I hope your wait was worthwhile. Thank you very much indeed.
It was lovely. Thank you.
Look forward to receiving those things you sent us. Right, that takes us to the next meeting, which I can't confirm at the moment. It may be, there is a possibility that we may meet in August if something happens, if we need to. Otherwise, it is scheduled for September, but we're at this moment, we're not in a position to be able to confirm that. We'll try and give as much notice as we possibly can. I have no urgent business. I can't see anybody indicating anything different than that. So can I just say thank you very much for your participation today and the excellent presentations we've had from the people who've made them. And thank you and cheerio.